Lithotomy position is a pushing position often used and suggested at the hospital setting. So it could be because the birther is with epidural with the last mobility, and also could be most providers are trained and comfortable delivering baby in this position. So I would like to demonstrate how the position look like. The birther will be laying on the back with the pillow support the head, and then pulling the legs will be external hip rotation, and then pulling the legs back in, and then chin to the chest. So when it comes to the contraction, we'll be pushing forcefully down with or without counting. So this is when contraction comes, how this position look like. So I would like to demonstrate on the pelvics why this is not ideal for pushing, because it's not opening the outlet. So when we lay on the back, we are actually gravity neutral. We are not using the gravity to help the baby navigate down, and also we are restricting the movement of the sacrum. And then being laying on the back and pushing forcefully down, we are actually creating more pressure on the perineal tissue and could be increase the chance of tearing. And then with the leg external hip rotation, we actually open the inlet side to side more, and which means we're closing the outlet side to side, decreasing the outlet space. Okay, so this is why this position is not ideal for pushing to help the baby to navigate out from the outlet and out. So when we when it's time to push, we guess where the baby is. When it's 10 centimeter, could be the baby still in the mid pelvis, which would be -1, 0, and +1 station. In that case, the birther might be feeling the sensation dipping in the body and pelvic floor or cervix area, and could be doing the movement side to side. If that is the case, then we actually would suggest the birther to do the pushing with the side to side using the rock through theory in order to maximize the space in the mid pelvis. But if we guess the baby is actually outlet station +2 and beyond, person might be having this rectal pressure or pressure in the lower bone, lower tailbone or lower sacrum area, and doing untucking motion, then we know baby's in the outlet. Then we can actually suggest the pushing to open the outlet. Could be, for example, external hip rotation to open the outlet from side to side. And then also could be reach up as well. Adding the reach up could be open the outlet from front to back. Okay, so I would like to demonstrate how this position can be modified in order to open the outlet. So can you see? Mm-hmm. Okay, so when we lay on the back, we will put 2 rolls of a towel under the SI joint, which is in the joint between the iliac bone and the sacrum. So here and here, left and right. So this towel will be under the SI joint. So this we will offer the sacrum can have a chance to move, nutate, to open the outlet front to back. Okay, and then birther can do the reach up, can also open the outlet front to back as well. And then we will suggest the birther to do the knees in, feet out, knees close to the midline. Then we can close the inlet but open the outlet from side to side. So this is when we know baby is in the +2 or beyond. So these are the modified way we can help the birther to push if the birther is really have to lay on the back. But if we know the baby is actually in the mid pelvis, then we'll suggest the birther also to push on the side, because the mid pelvis pushing on the side could have a less pressure on the perineal area and also create more space in between 2 ischial spine. So baby can navigate through the mid pelvis to go lower and down. So regardless which position you push, or where the baby is in the mid pelvis or outlet, we will also suggest the birther to have this breathing down, arrow down technique to ease out the baby and has less stress on the perineal area. So this video is lithotomy position to offer you a talk point to discuss in the labor before pushing, so you can have informed decision making.